I didn't experience anything, nothing. And it was during my stress test that they said there was something odd.
Initially, I was having symptoms, fainting spells, heart palpitations. My initial cardiologist was just band-aiding my symptoms.
I went to a male cardiologist who was trying to say that my problem was not a heart problem, it was a lung problem.
And you worry, and being a single parent, I worry that, is my lifestyle going to catch up with me sometimes?
When we look at the statistics and we see that more women die from heart disease than men, and we try to understand why is that happening, it's complex. So I decided to take it upon myself to come out here and then talk about the condition and help them understand why are we different, and what can we do to prevent becoming another statistic in cardiovascular disease.
I say to anybody that, is having symptoms that they can't find out what's wrong, go to a female cardiologist.
My message to all the women that are watching this documentary is to speak up. And do not let the silence become the ultimate silence event.
If they only knew more, if they only asked more, if they only said more. These are the powerful stories of women who made the conscious, life-saving decision to choose life over being a statistic. Hello, I'm Megan Clementi. Welcome to the first episode of the Heels vs. Ties docuseries, Treat Me Like a Woman. Whether you're a mother, daughter, sister, friend, or perhaps you're a man who has stumbled upon this with an important woman in your life, Dr. Nitza Alvarez, a board-certified cardiologist and one of the leading experts on women's heart disease, is on a mission to raise awareness and lower the death rate among women. Much of the premise of this docuseries is based on Dr. Alvarez's book, Heels vs. Ties. That for decades, if not centuries, women have been diagnosed and treated, as she puts it, like little men, rather than with the respect and understanding of our unique anatomy, biology, and symptoms. Women have been neglected, misdiagnosed, and undertreated. In fact, Dr. Alvarez recognizes how daunting but important the task of education is. Because according to the CDC, a little more than half of the women in the United States recognize that heart disease is their #1 killer.
I started my journey in 1999 when I went to medical school in Puerto Rico, graduated from there in 2003 and moved to New York to complete my specialty in cardiology. And as I go through the training in cardiology, then I realize the disparities that exist in the delivery of care between women and men. How come there's so many women still dying from heart disease and we still didn't understand very well? I am the oldest sibling of 10 kids, and 8 of those are women. My family, my mother, my sisters were my motivation, and then after that, of course, the experience at bedside with my patients, because now they have a diagnosis of heart disease that could have been prevented.
We begin by taking a closer look at the disparity in how women are treated, both from the patient and practitioner perspective.
I actually had a congenital anomaly, which they found when I was 44. So they operated on it, they corrected it. So that was my first cardiac experience. Then later on, I had a heart attack. And I didn't realize I did. I was on my way to dinner. And I said, I think I have to go to the hospital instead. I actually went to 3 different cardiologists up in New York. And I had stress tests and everything. And they didn't find anything. They said I was fine, but I kept having these chest pains. You really have to be proactive, and if you're having chest pains, they shouldn't be dismissed because you're a woman and because you're younger.
Considering my mother had a heart attack in front of me, and hers was not normal. She had the jaw pain and stuff like that. And then I heard it was differently. The doctor never said anything to me before they put stents in her and all that. Never said that it was different for women. And this is going back years ago, though, before they acknowledged that women's hearts were different than men's. The thing about going to the ER when you have chest pain, being a woman, you feel embarrassed. You feel, oh my God, I shouldn't be here. Oh, I'm not that sick. No, I call 911 if I have to. No problem. And I'm not embarrassed because I know women are different. And then some.
I was a golfer, and I was golfing the past 2 years, and I was running out of breath. The girls were running me to the hospital because they didn't know what was wrong with me. I really didn't have any idea what it would be. I thought maybe it was my breathing, my asthma, but it was not. I'd be sweating profusely, and I had to sit down. I had no energy, nothing. And this went on it just got worse over time, and it went on for 2 years. I went to a male cardiologist who was trying to say that my problem was not a heart problem, it was a lung problem. So I went to my pulmonologist, and he ran all these tests. And when I went back to my cardiologist, he said, no. He said, there's nothing wrong with your heart. He said, it's your breathing. I said, okay, bye.
It's not about the practitioner gender. It's about the practitioner awareness of the differences. It is not necessarily that a male physician cannot care for a female patient. It's that the male physician needs to know that a woman is different. For many years, we have been doing a lot of studies in men, so that's why the medicine that we practice today is male-centered. And that was extrapolated to a woman, like we are little men, like not understanding that our bodies are completely different, that it's not a body with different genitals, but there is still a lot of providers that are stuck in the old way of cardiovascular disease presents like this, which is what many times end up misdiagnosing a woman or not giving them the proper treatment because if you don't recognize the condition, you cannot treat it. It's also related to the fact that women also tend to put themselves last. So they will take care of their parents, they will take care of their kids, they will take care of everybody but themselves. There's a saying that said, I will die for my children. And I said, but will you live for them? And in order for you to live for them, you have to be healthy.
I think we put ourselves last. I really do. And we just don't have time to think of ourselves. And I'm probably the worst person to advocate because I don't, or in the past, I have not gone to doctors and whatever because I felt good. But I think that, and especially women, because we'll push our husbands to get health, and checkups and stuff, but we don't do that for ourselves. I think we're kind of bad about that.
You can take a back seat for a little while if you have to, because that's your job. You feel that you're the caretaker and the family's going to fall apart without you. But if you're not there healthy, you can't take care of nobody. But I will squeeze it in somehow or another because I know I have to be healthy, especially for my daughter that's sick. I need to be healthy for her.
It's a journey. It really is. My husband died last year, so it's really a new chapter for me. It is. It's really important now that I take care of my own health because, I'm by myself. But at that time, when you're a caregiver, you really don't think about it too much because you're so consumed with taking care of them. And I understand that it's important to take care of yourself also, except that I think most women just forget about themselves at those times when you're being a caregiver.
So how do we, as women, begin to take a more proactive role in our healthcare? To be heard, to develop the confidence in pushing for more information, to be, as Dr. Alvarez says, the CEO of our own health and be our own best healthcare advocate. It begins with speaking up and speaking out, knowing our bodies, and knowing that we deserve the best care available.
Nobody knows their body better than whoever lives in that body. So whenever I speak to women and I said, be your own advocate, what I mean is, if you don't feel good and you have been given a diagnosis that despite the treatment you're still not feeling good, or you don't feel good and nobody seems to understand what is happening with you, you don't have to settle for it. You have to continue to advocate for your own self, because eventually it can cost you your life.
Initially, I was having symptoms, fainting spells, heart palpitations, and I was seeing another cardiologist for a long time, a few years, but nothing was getting better. I was on a lot of medication. I was just sick and tired of feeling sick and tired. And the longer I complained, they just, again, chalked it up to anxiety, or they couldn't find anything.
If you're having symptoms, you need to find an answer. You do. I mean, they're not in your head. You know, they're not something that's just, you know, from stress or whatever. It's usually from something in your body telling you that you need to do something. I was in the hospital in the cardiac unit, and Dr. Alvarez came to see me. And I have 2 stents, which he put in. I was very surprised. I went to my primary care doctor, and he threw the folder down. He said, "You should have died." And I said, "Oh, thank you."
I think our generation, my generation, we were taught that they were right and we were wrong, basically. Listen to the doctor. I went to Catholic school. You had to listen to the nuns, too. But, I mean, you listen to the doctor. He's right. He's right. You don't question him. And today, in this vast world of internet and knowledge, we have the right to ask those questions. And they shouldn't be offended when we ask those questions, but a lot of doctors do. You don't have to be mean or nasty, you know, and if he doesn't answer your question or she doesn't answer your question, you just walk away, you know, walk away. And I can do that. I've done that.
Misdiagnosis in women is not uncommon, because we suffer from conditions that present differently than what would they be in a man. To give you an example, women tend to be prescribed more anti-anxiety medications, normally by a male physician or male provider, because they don't necessarily understand what is happening with them. It's not necessarily that women have more anxiety. 70% of the time, it has to do with the fact that I don't know what do you have. Women
Are different from men. A man, you know, when he has a heart attack, 9 times out of 10, it's the chest pain, it's his arms killing him. But women, a lot of us are different, and we don't have anything like that. My symptoms were getting out of breath. I couldn't even get a shower and get out and dry off I was out of breath. I walked out of the church one day, got in the car, and I thought I was having a heart attack. My problem was I have coronary artery disease now. That's what was causing the breathing problem. It was what was causing the angina after, you know, it got so bad. I sat down and bawled because I lost 2 years of my life because of some male cardiologist not even taking it serious. Now I've got my life back after 2 years, and it's all because of Dr. Alvarez. Her and her physician's assistant, I mean, they were thorough. They went over all the paperwork. They went over any tests that I had in the hospital from the other doctor. And this is what they came up with.
In my cardiology world, because I practice preventive cardiology, which I like to call it early intervention, is if you intervene early, if I know that you have certain risk factors, if you have a house that have a leak, will you wait until the next year can come to try to fix that, or will you wait until there's a hole in your roof, or do you try to fix it before that? So then that's actually the same analogy that I use for the health.
I'm in really good health, or so I thought. So I've been a vegetarian for 40-some years. I'm very active, even though I'm in my 70s. I work 3 days a week. What happened was I signed up with some of my neighbors for a prevention program. And we have to go through a bunch of tests, like to get a baseline. So we had labs and we had x-rays and we had a stress test. And it was during my stress test that they said there was something odd. Well, in my case, I had a 99% blockage. So, yeah, I probably would have had a heart attack within 6 months. She was surprised I didn't have one already, and she said it probably would have been fatal.
We practice in medicine that is a reactive medicine. That's why I like to call the health insurances the ill insurances. They're not for health. They are for illnesses. If people are relying on insurances to cover preventive care, then that will probably never happen. So we have to be willing to invest in our health. And yes, there's a little investment up front, but then it paid off long term.
I don't have insurance, so everything for me is self-pay. So that's why I do a lot of the preventative treatments that I do. Since I'm paying out of pocket anyway, I'd rather do preventative treatments than end up having to come out of pocket, with hospitalization.
When we buy insurance and we are relying on insurances to cover our preventive care, that it will be like having a car insurance and pretending that the car insurance cover your oil changes. We don't run it through Geico or through Allstate. We don't go there and say, oh, here's my car insurance. They're like, your car insurance doesn't cover that. So I want people to start thinking like that, to start thinking, well, I know my insurance doesn't cover, but I know that this evaluation or this screening is going to help me to maintain my health. So I'm okay paying for my test when I go and see the doctor that is interested in knowing what can they do to help me stay healthy.
What I would recommend is that more women especially go to these prevention programs, because the insurance companies don't really pay for a prevention program. And if I had survived a heart attack, they would have had to pay a lot more than I paid privately for this prevention program.
It was worth every penny because for me, I'm a warrior. And so I value my health, and my children value my health because, if I'm not spinning the plates, I don't know who is.
I want to include here that when we think about the upfront cost of preventive care, that it might be a few $1,000s. But day after day after day in my clinic, I see patients that are struggling to find the $500 per month to pay for the pill that now they had to take because they have a cardiac condition.
The statistics speak for themselves. Cardiovascular disease is the #1 killer of women, causing 1 in 3 female deaths each year, more than all forms of cancer combined. And yet, few would argue that heart disease has not reached the level of public consciousness as, for example, breast cancer awareness.
The gap is humongous. The gap is big. Granted, we had to recognize that it's getting closer because now we have the American Heart Association that recognize that women are undertreated, are underdiagnosed, and we're being dismissed. More women are dying, and now trying to understand why is that happening and what can we do. Nobody wants to have a heart condition, so we ignore it, or we tend to excuse it, or we tend to find other reasons why we're having them. And even sometimes even the providers don't want to think that you have a heart problem because you are too young for that, and we don't think about it. The education had to happen in 2 aspects. It had to happen from the provider that is going to deliver the care. It had to happen from the woman that is going to receive the care. So my goal is to close that gap of knowledge in women when they're going to receive the care. Because if you don't know what are your risks, if you don't know what to seek for, if you don't understand that our symptoms are different, you can be experiencing them, but you don't know. And like I said so many times, if you don't know and your provider don't know, that's a recipe for disaster.
I think that I was definitely dealt with differently, definitely. I went to see 3 different cardiologists and no one did a thing. And I knew that something was probably wrong. But now I think people are more aware, doctors are more aware. I think people like Dr. Legato, who's the person that wrote that book, The Female Heart, and Dr. Alvarez wrote a book, Heels versus Ties. Both of them, and probably a number of other female cardiologists, have made people more aware of the fact that women are more prone to actually having heart disease.
While we have been entirely focused on heart disease throughout this episode, the necessity to speak up across all aspects of our healthcare, particularly if you're a woman, is punctuated by Dr. Alvarez, as well as recent reports and studies.
We still live in a society that women don't speak up a lot. They don't question, they don't ask. There is a recent article that came in US News that said that if you are attended by a female surgeon, you will have better outcomes in your surgery. There was an article that came in US News probably 3 or 4 years ago that said if you don't want to die before your time, get a female doctor. I believe that is because you need a provider that will listen. You need a provider that will be engaged with you, that is there for you, that they're not just in their own agenda.
I think as women, you trust your physician to do the right thing for you, but sometimes we do feel like something else is wrong. You have to trust that instinct and try and find someone that advocates for you. It's hard to explain the feeling that you get when someone actually listens to you and you figure out what your diagnosis is.
I've got 2 friends that the doctors were saying, well, there's nothing wrong. We can't find anything. We just don't know what to tell you. Well, I told them, you go to a different doctor. You think it's your heart, go to the female cardiologist, not a male. Nothing against the males. It's just that we're different from a man. Our bodies are different. I mean, I really think that. I mean, I'm trying to keep from crying, but Dr. Alvarez saved my life because she said I would have had a heart attack eventually on the golf course.
%80 of heart disease is preventable, which is the reason why it's so sad when we hear about the statistics that about 500,000 people still die from heart disease in America. And when we think about women, about 380,000 women die from heart disease. It's preventable if you can, number one, live a life to prevent the disease, and also preventable if you can detect it on time so you don't become another statistic.
Women's heart attacks and heart issues present very differently than men's. And I didn't know some of the symptoms that women either experience or even lack thereof don't experience versus what a traditional heart attack would be. And I'm in that age range now where you have to be a little bit more attuned and aware of, you're just transitioning into, an older lifestyle. And so you have to just be very cognizant of any little change. Sometimes you need to be aware of those because it could be something more serious.
My message to all the women that are watching this documentary is to speak up. Never be embarrassed about activating emergency medical systems because you think that you have a heart problem and then you ended up in the emergency room and they tell you it's not your heart. Never be embarrassed to keep talking to your doctors about how are you feeling. Never be embarrassed about speaking about your symptoms because that is the reason why we continue to bury so many women.
I got up one night and I had chest pains. And I said to my husband, call 911. He goes, what's the matter? I said, just call 911. Tell them I'm having chest pains. And I went. And they had no clue what was going on. And I said, ooh, maybe I shouldn't have called 911. I went home, went to see Dr. Alvarez, and she said, right away, don't ever think twice about calling 911 again because you didn't find nothing. That is an important lesson also to learn.
If I pass the information to you and you pass the information forward, then more women are going to know that we're different, so they will know to seek medical attention. And hopefully through that cascade that we will create, we can save the life of thousands of women. I'm only one, but I count on you to be able to pass that information. I count on every woman that is watching this documentary, every woman that come in contact with you to be able to get this knowledge so we can continue saving more lives.
In future episodes of this docuseries, we'll take a closer look at the efforts being made by Dr. Alvarez, the cardiology community, and even Congress to continue to close the gap in care between men and women. We'll also take a closer look at the power of a preventative approach to our healthcare, including the Nitza MD program, and why we often treat our cars better than our bodies.
So why do we actually do take care of that car? Take it for checkups, maintenance, oil change, and check the brakes whenever we're gonna go on a trip, because we want to make sure that that car is working as its best, but we don't do the same thing with the body.
And we'll put some women on the spot to test their knowledge of their own heart health. Some of their responses may surprise you. What amount of money would you guess they are estimating that it'll impact our own economy by the year 2035?
I'd say 1.2 million, maybe.
Over $1 trillion. On behalf of Dr. Nitza Alvarez and all of our brave and inspiring women who you've met during this episode, I'm Megan Clementi. Thank you for watching.
We invite you to subscribe to the Nitza MD YouTube channel so you'll receive alerts when new episodes of this docuseries are posted. To see your potential risk level for cardiovascular disease, take a brief online quiz at nitzamd.com. Heels vs. Ties, Living with Your Number One Threat is available on Amazon and Audible, or learn more at heelsversusties.com.